The way maternity care is built, for the most part, is that it is actually a package. It's a package price. It's a package deal. So there's so many prenatals, there's the birth and labor cost, and then there's the postpartum cost. And it's a package, in a sense, in the background of the insurance world. And so what that means is that if you were to call in and say, I'm cash paying, what is the price for my maternity care? They actually will provide that to you. And it is substantially less than if you were to use your insurance. And the reason why is because there's a whole other system to one-up one another and to gain as much as possible when it comes to the balance between hospitals, insurance companies, and the government, whatever that may be. So those who needed to be on the Medicaid assistance program. Now that the government has identified that there are cuts going to happen and are already happening for some of these states, the states that didn't have a surplus of funds like California or New York, who can move around some things in their budget to help support that change, they're having to completely just cut it altogether. And so we're seeing a lot of that for the southern states or maybe the Midwestern states and some of the East Coast states that are smaller, where they literally don't have the budget. And that's just because of their own economics as a state. So that's why people are starting to get cut now, because the financial responsibility has now been identified to be per state. So states that don't receive a lot of money or don't don't have a lot of taxes coming from their patrons, they literally don't have the money to support the Medicaid process.
And those are the states that need it the most.
Almost always.
The poorest people who need the coverage the most.
MINE Maternity is essentially an insurance navigation support company for maternity providers. So that's, supporting our doulas, our lactation consultants, our midwives, our OBs. Really, if it's within the maternity scope, even if it's like chiropractic care, but they focus on maternity patients, we support them in making sure they can help you. So that's oftentimes how we're met with families, is through your trusted provider who says, they can help you with reimbursement, or we can, support with claims and any billing questions, or even, navigating your insurance benefits or employer, specialty benefits. So that's a little bit about what we do. So it's not just right now, if you look at your evidence of coverage, aka your summary of benefits.
Summary benefits, yep. Or SOB, as I call it, which...
That stands for something else.
It does.
Sure does. And it is, unfortunately, exactly that when it comes to your... Not very helpful at times. But if you look at that, all they have is maternity. Maybe they'll have a facility fee. Maybe they'll talk about the physician. And that's it. They don't talk about, seeing a chiropractor. They don't talk about seeing a pelvic floor therapist and where to find that in your summary of benefits, your SOB. Definitely not doula care. Definitely not midwifery care. Even if these things are covered, which I'm seeing. So we're working on closing that gap.
Which doulas are a lot of times.
Yeah. And so they're covered services, but they're not in the summary benefits?
They're not detailed, listed out. Yes, that's correct.
Huh. I wonder why.
And I look at one every single day.
They don't
so
want
I'm
you to
seeing.
They want the doctors to get the money, not the doulas.
Okay.
They all are working together to get as much as they can possible. That's why when you pay out of pocket for something, it may be $50, but when you see your insurance plan and you used your insurance, it was suddenly $300. And
It's
the
wildly
insurance covered $250 of it, and then you're still maybe paying $50, but the price you see is that $300. It was never $300.
Yeah.
Okay. It was $50 to begin with. They just found a way to mark it up again for all three to somehow benefit, or for one to get more than the other.
I did cash pay.
I see that at the dentist's office quite a number of times.
Not a lot of people have dental coverage. And
I pay cash at the dentist, and they make a point of showing you the paperwork. So if you're paying cash, this is what you're going to pay. If you had insurance, this is what we'd be charging. And it'll be a few $100 that you're paying cash, and the insurance is like $2,000.
Yeah.
It's like so many times more. It's crazy.
So that's where we started working with providers. So hopefully your provider or even your Medicaid office knows about MINE Maternity because we are partnered with you all. So we're really working on partnerships. This is what we do. This is what we do. The moment providers heard of us, it was instant connection. It was like, we see the value you would provide our business, because we work with a lot of solo practices, but also like collectives and agencies or like small clinics. So they said, we can see the value because we don't have the bandwidth to answer these benefit and insurance questions or help our patients or clients, depending on, how they refer to them. But, help our clients with the care coordination piece. We don't have the bandwidth. So the moment they found MINE Maternity, we found them. And then, of course, once they said, hey, my client, meet MINE Maternity. Okay, hi, nice to meet you. Here's my life story.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com. And we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.